Are you checking your blood pressure every single day or just once a month? Are you confused about what's right? Checking too often can cause anxiety, but checking too little means we miss important information. I'm Dr. Lim, and today we are going to clear the confusion. The answer as for how often to check your blood pressure depends on your situation. I will break it down into 3 common scenarios. The first scenario is the new and changing phase. This is you if you've just been diagnosed with high blood pressure, you've just started a new blood pressure medication, or you've just had your medication dose changed. In this case, we need the most data, and the best way to do this is through what we call the 1-week blood pressure diary, where for 1 full week, you measure your blood pressure twice a day. Once in the morning before you take your medication, and this tells us if the previous dose lasted for 24 hours, and once in the evening before dinner or at least a few hours after your evening medication. This 7-day diary gives your doctor a beautiful, clear picture of your treatment and whether your treatment is working. And after that, you can stop until your next review. The second scenario would be in the stable and controlled phase. This would be you if your blood pressure has been stable and has been at target for several months. The good news is that you can relax. You do not need to check it every day. This will just create stress. So for most stable patients, checking 2 to 3 separate days a week is plenty enough. But there's also the option of using the 1-week blood pressure monitoring as per scenario 1, and this would give very accurate readings as well. The third scenario would be what we like to call the white coat phase, and this for people whose blood pressures are high in the clinic, but we suspect may be normal at home. To diagnose this, the doctor will ask you to do a full 7-day home blood pressure monitoring diary, and after that, you likely follow the same stable schedule as we just talked about, the 1-week diary before your next checkup, or the 3 to 4 blood pressure readings in a week. But none of these readings matter if they are wrong. Your technique is critical. So remember these simple rules for an accurate reading. The first is rest. Make sure you sit quietly in a chair for 3 to 5 minutes before you measure. No talking, no watching TV. Number 2 is position. Make sure your feet are positioned flat on the floor, not dangling across, and your arms bare with no sleeves and resting on the table at the level of your heart. Number 3 is to make sure that you have a validated machine and the cuff size is correct for your arm. And finally, you want to repeat the readings by taking 2 to 3 readings 1 minute apart. The average of these readings is a true number. So let's say your first reading is higher than the others, you should discard that and take the other blood pressure readings. So, in summary, if your treatment is new or changing, check your blood pressure twice a day for 1 week. If your blood pressure is stable, check it 2 to 3 times a week, or just do a 1-week diary before your next doctor's appointment. The goal is not to be too obsessed with getting as many blood pressure readings as you can, but to gather high-quality data. So bring your blood pressure logbook to every appointment because it contains useful information for us to get your treatment exactly right. I'm Dr. Lim, and I hope you found this video useful. I'll see you around in the next video. And until then, bye!